write your name in the chat box. So I want to introduce you today to the great people we have on the call to facilitate today. Our OPQC clinical lead, Dr. Jay Imes, is with us today, as well as Sean O'Hanlon from Duet Health. He's going to share about the PRAF 2.0. Alicia Brown from Medicaid, she's going to help us make sure we can get on the PRAF 2.0. And then we have our OPQC quality improvement team. I'm Kathy Jaworski, and I'll be facilitating the call. And Mary Bauer and Andrea Holberman are on the call as well to assist us with monitoring the chat box and answering any questions as needed. Next. Our agenda for today, Dr. Imes is going to talk to us about how the PRAF, what we learned from the progesterone project about the PRAF 2.0, or how the PRAF 2.0 helped the progesterone project. I'm going to tell you everything you ever wanted to know about the PRAF 2.0, but we're afraid to ask. Alicia Brown is going to share how to get access to the PRAF 2.0 through the MIT system. Sean's going to tell you how to use the PRAF 2.0, and then hopefully we'll have a few minutes for some questions. Next. Dr. Imes?
Thank you, Kathy. As most of you know, OPQC has been working primarily to improve infant outcomes, infant mortality specifically, and the key driver of infant mortality related to prematurity and other problems. You can see Ohio is dark blue, and the darker blue you get on this slide, the worse your rates of infant mortality are, and that's why we were founded about 10 years ago because of that. Next slide shows the contribution of prematurity to the causes of infant death. Prematurity is number one in Ohio as a cause of death, and that's one of the reasons that the progesterone project was so attractive to us. But this is a call mostly about the PRAF and how it was born from the progesterone project. So the next slide shows us what we were doing about prematurity and what we were trying to do with the progesterone project. We were trying to find women who were most likely to deliver early, women with a prior premature birth, women who had a short cervix, and we probably underestimated the women who don't have any other obvious medical risk factors. So we really want to focus as we go forward, not only on women who have those obvious risk factors, but women who have perhaps more social determinants of health and other problems. So our experience with the PRAF and the progesterone project led us to the next slide, in which we learned about various barriers. This was a process that I'd started with identifying barriers and then figuring out how to overcome them. And there are barriers to the providers at the point of care. There are barriers when you inform a Medicaid managed care plan or other insurance agency that this patient is eligible for an intervention. They have some things that need to be done quickly. Each woman has unique barriers for her own situation, whether it's family support or transportation or multiple other children. And there are a lot of people trying to help everybody. There are lots of agencies, lots of other people, but what we really learned is that those people can't find each other. They can't talk to each other, and they especially can't talk to each other in an efficient manner. I'll show you in the next couple slides that we were able to overcome that, at least in part. The percentage of high-risk women who were actually using the progesterone prescriptions increased slowly and steadily, not to the degree that we would have liked, but we did find that it was increasing. And if you look at the next slide, you'll see that from 2012 in the upper left corner, red is bad on this slide and green is good. Red is less than 22% of the women who are eligible for progesterone getting it, and dark green is better. And so as you go through those years, the first 2 years was before our project. And as you go from 2014 through to 2017, you can see that the proportion of the state with green colorations suggesting that more than 30% of eligible women were getting it. Those are still not satisfactory, but part of that improvement was because we had many phone calls with the various sites across the state and with the various agencies, the managed care plans and other agencies, Medicaid, vital statistics, etc., to try to figure out why can't we get together more efficiently. And that's really how the PRAF was born. We need a rapid electronic way to let everybody know this woman is pregnant and she has this problem or that problem, and it isn't just a progesterone problem, it's a problem for anything that might complicate a pregnancy. So that's the background of the PRAF, and I think that this is probably my last slide. I can turn it over to Kathy again.
Thank you, Dr. Imes. Does anyone have any questions for Dr. Imes?
I'll be on the call until the end. So if you think of any, just you write them in or speak up.
Thank you. Perfect. Next. So that we can get a clearer understanding, and so you all know who all will be on the call today. Today we have quite a few OPQC groups that have been invited. The Maternal Opioid Medical Support Plus, OPQC Moms Plus project, the Smoke-Free Families project, the Preventing Prematurity Through Progesterone project. And we want to ask some questions about where you all are coming from today to give us a little clarity. So on the polling question, which of these groups describes you best? As I mentioned, are you one of those OPQC groups, or are you just wanting to learn about how to get started to use the PRAF? Or are you from a managed care plan or a home health agency, or do none of those describe you well, so you could fit in the other column? Can you ask that polling question for me?
Kathy, this is Bianca. So the polling functionality just failed, but that's okay. Don't fret. Everyone, if you can respond to that question in the chat box, that would be great.
Thank you.
And also, this is Andrea. These are not mutually exclusive, so you can reply with more than one. Thanks.
Thanks, Andrea. We'll go ahead and let you put your notes in the chat box for us, and we'll move on. Next. So I'm going to tell you a brief history about where the PRAF has come from. Prior to 2015, the managed care plans and the fee-for-service section of Medicaid all had their own notification of pregnancy system. The form, I understand, had multiple pages. It was pretty lengthy. Practices would fax it to the county. The county often the forms weren't faxed. You know, you would wait a week and fax your group, or sometimes even longer. Then when they got to the county, they waited until they were reviewed, and then they were faxed to the managed care plan. And it was discovered that often the managed care plan didn't even really know about the patient's pregnancies until after the infant was delivered. In 2015, Medicaid worked with OPQC and multiple practices from obstetric practices from around the state to kind of test and refine that, to improve that pregnancy risk assessment form, standardize it. So they got all the managed care plans and the fee-for-service section to agree on one form. They made the form short. It was 2 pages long, and they consolidated where that form needed to go to. So with this form, the form is faxed to the managed care plan, to the county, to the pharmacy, and to a home health agency if needed. From there, it was decided we still needed something that was faster. This still took quite a bit of time. Patients' insurances were still getting denied or getting, they had to reapply for insurance. So in 2017, Medicaid developed an electronic pregnancy risk assessment form known as the PRAF 2.0. Now in this form, there's a pretty automatic notification to the county of eligibility. It goes pretty quickly over to the Ohio Benefits Eligibility System once it's submitted. It provides a home health referral. It also allows you to print a specific patient prescription for each patient that can then be signed. And it allows for outreach for Medicaid to help with outreach for patients who are needing some incentive programs. Next. This is a picture kind of the old ODM form, and some practices are still using it. You may still be using it. Typically, forms get copied, they get put in the desk, and we use them for quite a while and don't even realize that we have an old form. So this old form, the day of the old ODM form 03535 it died in November 14th of 2016. Next. Now the new written ODM form is the 10207, and that we call the paper PRAF form. The data is similar, it's consolidated, it does still need to be faxed to the managed care plan, to the county, and to the home health agency when needed. Next. Now, why would you want to use the PRAF 2.0? The first, one of the really exciting pieces is as I had mentioned before, is it helps prevent the loss of Medicaid coverage. The very quick turnaround when all the information is correct will help you to help your patients not lose insurance, help you not have to help your patients get back on the insurance. The next thing is it really can help with coordinating the patient's care. Medicaid and the offices all are doing a lot of great work at helping at caring for patients, at managing patients' care, but there isn't a lot of communication. So this form is really to help communications. We're working on this. It's a work in progress. We need offices and the managed care plans to help you improve that communication. Another really exciting piece, I think, as a practitioner that has worked as an office manager, I know sometimes it's not always easy to get in touch with someone from Medicaid. We're going to give you direct lines to Medicaid to get in contact about the PRAF 2.0 and issues that come up with this system. Next. Amy Moreland is with us from McCampbell Hall at Ohio State University, their OB/GYN practice, and she agreed to share some of her experiences with using the PRAF 2.0. I believe Amy's been using the PRAF 2.0 since its inception in June of 17. Hi, Amy.
Hello. Yep, as you said, I'm from Ohio State, and we've been doing the PRAF since I think it started way back when the paper form, faxing it, and then switching over to the electronic version. If you're first trying the form, just remember it takes a few tries to get used to it, but once you start doing them more regularly, it really does go much faster. So just hang in there if you're new to it. For our clinic, I noticed a big improvement, as you said, about patients maintaining their Medicaid. We were having trouble with especially our progesterone patients that could possibly drop their coverage in the middle, and then we weren't able to get them their injections or their medication. So I have seen a big improvement in our patients being able to continue their coverage and maintain their prescriptions and their medication throughout their pregnancy. So that's been really helpful. And then you were talking about how it has areas that you can alert Medicaid when patients need assistance, such as smoking cessation, transportation, behavioral health. I recently had a call from a Medicaid provider that one of our patients was having some housing difficulty, and she had noticed that I had marked on the form that I didn't know of any needs the patient had. And she reached out because she wanted to make sure that we were aware that the patient did have some problems and concerns, and I didn't have that noted in our chart. So I was able to get her connected with our social worker and provide her with some additional resources. So it was really great to have that communication. And then also with our progesterone patients, I've had calls, you know, to make sure everything was going okay, that our patients were getting started without any difficulty. So for us, I feel like it's just a great team effort to help our patients get the care they need. So it's been great.
Yeah, thank you very much, Amy. I love to hear about that coordination with Medicaid. Thank you. Next. Other reasons why the PRAF 2.0 would be appealing to you is you can get paid for it. Every submission you'll get paid for. Each managed care plan and fee-for-service reimburse for the form, and you can complete it multiple times if there's a change in the patient's condition or at each trimester. You can complete it multiple times and get reimbursed. The data is shareable, so multiple users can enter onto the system. So if you have a clerical staff that you want to enter maybe the demographics of the patient into the system, and then you want your nurse or patient care provider to enter in some of the more clinical pieces, you can do that. One can start it and one can finish it. You can see some individual site level data. So you can see how many patients you've entered. You can see how many patients needed progesterone. You can see how many patients accepted progesterone. Again, it's a really great site level data, and Sean will show that to us later. And it does afford easy referral for home health visits for Optum and Option Care. It can all be done straight through the PRAF 2.0. We have two other offices that agreed to get on the call with us today to share their experiences with the PRAF. Heather Westcott and Robin Lucas from Erie County Health Department. They've been using the PRAF 2.0, I think, for a little over a year. Is that correct, Heather?
Yep, just a little over a year, Kathy.
Oh, welcome, Heather. You feel like sharing your experience with that?
Yeah, so we are a local health department and then also a federally qualified health center. So we see OB-GYN patients throughout the week. And we were doing the paper risk assessments that we sent to our jobs and family services at the county level, and had a hard time with the paper copies. You know, JFS workers, they're just as busy as us, so sometimes there would be a little bit of delay, up to like a month or so, and making sure that our patient's coverage maintained her coverage or getting connected to coverage. So for us, the electronic PRAF is very easy to use. We have several staff members that do it a couple times a week. Takes about 2 minutes for each PRAF to be submitted electronically versus out the paper form and then having to send it via courier to our JFS. So it's super easy to use. And we are billing Medicaid for it and are getting reimbursed. And then we haven't had any issues with doing the PRAF and our patients losing Medicaid coverage. So we have not had anyone lose Medicaid coverage that we've submitted a PRAF electronically on.
It's very exciting. Thank you very much, Heather. And if you have any questions for either Heather or Amy, and as well as our next speaker, please put them in the chat box and we'll make sure that we get them answered for you. Next, Christina Schaefer from ProMedica Center for Women's Services is on the phone. And ProMedica has also been using the PRAF 2.0 since its inception in June of 2017. Hi, Christina.
Hi.
You want to share your experiences with the PRAF 2.0?
Yes, we have found that using the PRAF has been very user-friendly. We get quick responses if there is something that you miscommunicate on it and you need to get in touch with the PRAF. People who look over it, it's a quick response to help get that taken care of for you. We found with our patients also not losing the Medicaid coverage during their pregnancy. This has been very helpful with that versus having to follow a paper trail. It's nice that it stores the PRAF in there, all your patients. If you need to go back and print the PRAF back out for any reason, it's very easy to do. You're able to load in and save certain information, so it makes it very time efficient. Even if the patient is a progesterone candidate, it only takes a few extra minutes to complete that section for that. And just the turnover rate and efficiency to getting the patient to have the proper script and their insurance coverage and all of that to get the progesterone to them and get it started on time has been really effective for us here.
Thank you very much, Christina. That's exciting to hear. Thank you very much.
Mm-hmm.
From the registration, when you registered, at least if you registered before 8 o'clock this morning, we asked you if you were currently using any type of pregnancy risk assessment form, and the answers from that survey were 68% of you are using a PRAF form of some type, and 32% of you have not started using a PRAF yet, but wanted to learn more, so you came on today's call. Next, Alicia Brown from Medicaid is going to share with you how to get access. I'm sorry, we have a polling question. I'm sorry. Will the polling questions work, or are they still?
Yes. And Kathy, we actually do have a question before we get to the poll. Good news, the poll does work, so we can get to that in just a moment. But the question is, who do you bill for PRAF form, and is it still the managed care?
I am going to talk with you about some resources toward the end of the call where I can tell you exactly where to find the billing information and how to bill for the PRAF 2.0. You do bill the managed care plan that for each patient, whatever managed care plan that patient has, and I'll review that with you further later in the call. Thank you for that great question. Let's go ahead and start on this pop quiz. We wanted to get a little better idea of how many of you on the call what type of PRAF you're using for those of you that are using. So the first question, I'd like to know, do you work in an office or a health department that cares for obstetric patients? And that's a simple yes or no. And here it comes. Now, Brianna, I don't see it. Is the polling question going?
Yeah, Kathy, it looks like we're getting some answers coming in now. About 13 of our attendees have already answered. We're about 25%, so I'll let it run a little longer.
All right, thank you.
Mm-hmm.
So I don't see it either. So I wonder if there are others who can't. Maybe there's something they have to do.
Now, if you can't see it, just go ahead and put the answer in the chat box, and we'll be sure to record it. But those who can see it, just keep answering, and we'll end it in just a moment.
Thank you. In our next polling question, if you answered yes to number 1, I'd like to know which PRAF form you're using. Are you using the older Medicaid written version, the 53535, the discontinued version, or the current written form 10207, the electronic PRAF 2.0, or a managed care plan's notification of pregnancy form? or presently you're not submitting a PRAF? That will be the questions for the next poll. And Brianna, can you tell me if you're able to submit that poll?
All right, Kathy, we're going to go ahead and end the poll. And we should be able to see the answers here in just a moment. And we're sharing the results now.
Are those on Cole's screen?
Let's tell them.
All right, so it looks like for the first question, do you work in an office or health department that cares for obstetric patients? We have about 19 people, that's 83% answering yes, and then 26% answering no. And then for the second question, if you answered yes to one, which type of pregnancy risk assessment form do you submit? We have about 13% with the Medicaid written version, 10207. We have 26% with the Medicaid electronic PRAF 2.0. We have 22% with the managed care plan notification of pregnancy form, and then 48% presently do not submit a PRAF or know what it is. And I want to go back up to the Medicaid written version, the 53535. We have no one saying that they do submit that form.
Thank you. That's great to hear. Thank you very much for submitting those. That will help guide us to help you. Thank you. Now Alicia Brown from Medicaid is going to tell us how to get access to the Nurture Ohio system through the MIT system. Hi, Alicia.
Good afternoon. Can everyone hear me?
I can.
Okay, perfect. So thank you for the opportunity to speak. It sounds like Jay and Kathy, you both have shared some very useful information about the PRAF. And I also wanted to touch base on some things that I heard just briefly from the testimonials about the benefits to the providers. And I really just wanted to key in on that the Nurture Ohio system that houses the Pregnancy Risk Assessment 2.0 is actually the only system within the state of Ohio that is connected directly to the eligibility system for our Medicaid patients. So that means that as soon as you submit the notification of pregnancy online through the Nurture Ohio system, it is going to automatically update that pregnant person, that pregnant individual who is on Medicaid, their eligibility status. And so what does that mean to you as the provider? It means that that member that you are seeing is not going to have any gap or lapse in coverage. Which means that you're not going to have any delay in payment or reimbursement for the services that you're providing to that member. And in addition to that, what I also heard is that you also get reimbursed for the submission of the form that you're submitting to the managed care plan. So there are some benefits as well to the patient. As far as coordinating the care and making sure they're receiving the services that they need for prenatal care, but also to the provider. So I thank you all for joining this webinar again, and welcome the opportunity to tell you how to access the system as you're continuously interested in submitting the notifications online. So to access the Nurture Ohio system, there are simple steps that you have to follow. There are 3 steps. So the first is you have to be a MIT user, which is Medicaid's Information Technology System. The second is that you need to identify your MITS administrator. You need to have the MITS administrator identified so that they can assign your prenatal visit agent role, which is what gives you access to log into the Nurture Ohio system. And then you need to do the final step, which is access the Nurture Ohio system using your MITS login credentials. Next slide. So the first step is, if you are not already a MITS user within our system, that you need to go ahead and gain access to that system. And so if you follow the link on below here on the screen, you can actually see details on how to become a MITS user and what steps to take. It's very simple, and if you are a Medicaid provider, it doesn't take long. You need such information such as your billing or your national provider ID number and your tax ID, and you should be able to get access to that system very easily. Next slide. So here are just some screenshots to give you some idea of what steps you would have to take to kind of walk you through that process. So you will just go through to the MITS website, which is at the top in the blue bar with the web address to go to. You'll select the agent setup, and you'll just click on that link. Next slide. You'll scroll through and you will accept the MITS or Medicaid Information Technology System portal agreement, and you'll agree to that. Next slide. And then you'll set up your unique identifiers and adhere to the password and ID guidelines that are provided through our system. And once you register with the system, you simply have to wait 30 minutes prior to trying to log into the system. And so you could easily get access to this system within an hour of your initial trying to access the system or get credentials for the system. Next slide. And so then you'll just go back in 30 minutes later, and you will log in using the credentials that you just identified. And then you'll go to the My Information page, and then you'll just set up your challenge questions. So that way, if you ever forget your password or need to gain access to the system again, you can answer those challenge questions and get your password reset. Next slide. And so you've completed step one. If you already have MITS access, you can go directly to this step, which is step two, and that is identifying who your MITS administrator is so that you can get your prenatal visit agent role assigned. Your MITS administrator is typically someone in your billing department. So when we talk to most provider sites, if you are able to speak with someone who is either your office manager or someone who's working in the front office, they should be able to assist with identifying who this person is. If you are not able to identify who that person is, some of the larger health systems only have one or two MITS administrators who are not particularly in their practice. So if you do not know who your MITS administrator is, please come prepared with these 3 key points. So I need you to identify your NPI number for your practice, your tax ID for your practice, and your specific practice location, address. And then you can use that information and do one of 2 things. You can contact the Medicaid provider contact number that is listed on the screen and provide that information to them, and they should be able to contact you back within 3 to 5 business days with that information. Or you can also try to contact us directly, and there's an email address that I believe Kathy is going to go over with you, where you can email that information to me, and I can try to assist in helping you get that information more timely. Next slide. And then once we identify who your MITS administrator is, we recommend contacting them directly, and you can do that via email, and you can submit your username to them and letting them know that you need to be assigned the prenatal visit agent role. And they can do that for you with some simple steps, and you'll provide them as well with your tax ID number, and they'll be able to follow the steps that are within step 3 here on this slide in getting you access to that prenatal visit agent role, because they have their own steps that they need to follow within the MITS system to give you access. Next slide. And once you get access to your prenatal visit agent role through your MITS administrator, you should then at that time be able to go to the Nurture Ohio site, which the URL is at the top in the blue box, and you'll submit the drop-down box here that says system. You'll make sure that it has MITS selected. You'll enter the new username and password that you developed for the MITS system, and you'll simply log in. So again, those are 3 easy steps to getting you access to the system so that you can continue to ensure that coverage isn't lost for women during their prenatal period. And of course, if you have any additional questions, feel free to contact me, and I will be able to assist you as much as I can to get you access to the system.
Thank you. I'm going to show you where this information is available to you later on in the call, as well as we're going to send these slides out for you tomorrow. Next, is that anything that you wanted to say anything about, Alicia?
Yeah, I kind of covered it in the first one, just letting you know that that was simple. You got access to the system, and that congratulations, you did it. You now have access to submitting online, and you're able to link in simultaneously to all of the entities that you mentioned earlier.
Thank you. Next, Sean O'Hanlon from Duet is going to tell us about how to use the Nurture Ohio system and enter your pregnancy risk assessment form data. Sean,
perfect. Thank you very much, Kathy. Yep. Just need to share my screen here in a second. I think I just need to have the permission passed over to me.
Okay.
All right, Sean, give us just a moment. We're going to give you those privileges here in just a second.
Perfect. Not a problem. Thank you very much. I guess I'll get started in the meantime. So I'm Sean O'Hanlon. I work for Duet Health, and we worked with the Ohio Department of Medicaid to build the Nurture Ohio site, which houses the PRAF 2.0. So as you saw in the screenshot that Alicia shared a moment ago, that was the login screen. And so I'll briefly cover in the login process, sort of once you've got that whole MITS thing squared away, just like she was talking about, and being able to access it that way. Then being able to just get logged into the site, and then how to sort of start a form, save a form, and a few of those kind of basic topics is what we'll end up going over. Just trying to, let's see. I still don't see.
Hi, Sean. This is Bianca from the tech team here. So you should see new share on your screen. Please let us know if you do not. There's a kind of a share up arrow at the bottom of your screen. You should be able to click that and then share your window.
Perfect. Yep, that just popped up. Awesome. Are folks able to see my screen now?
Yes, I can see
login
it.
screen. Perfect. Great. Thank you very much. Yes, so this is the login screen. Share the URL. It's nurtureohio.com or progesterone.nurtureohio.com. Either of those things basically end up in the exact same place here. And so for all of you guys, the good thing is that it defaults to this drop down that Alicia mentioned. It does default to MITS. So every time you come here, it should be right away show that in there. And then you'll log in with your username and password from MITS. Should you have any issues, we created this sort of easy help thing here to be able to either link over to the Medicaid site that has some documentation and additional help features there, or just the email address to be able to sort of send an email off indicating any issue you're having. And this could be an issue with logging in, or just any other questions you may have about the PRAF in general. Maybe you made a mistake on one or issue, or you needed to sort of talk through anything like that. That's a great resource for that. So I do not have a MITS thing, so I'm just going to go ahead and log in here. But once we get logged in, the sort of flow will be the exact same that you will see on your end when you log in with your MITS, account. So this is the first screen you see, assuming you've never submitted any forms or anybody else in your practice has never submitted any forms. You'll sort of see this blank screen here. And this is our patients in process tab. And so as Kathy mentioned, just because maybe you started a form doesn't necessarily mean you have to be the one that submits it. So if however it works within the sort of flow of your practice, somebody maybe could enter in all the patient demographic information. Somebody else maybe goes back later to indicate whether progesterone was needed for that patient. Whatever works. Obviously, we're here to support you in whatever way that looks or form that takes in your office. But first we'll go through the form process of adding a patient. So as I hit add new patient here, the first thing you're going to see are these two boxes here: practice information, prescriber information. Prescriber information is sort of the optional part of this page. What that's going to do is allow you to maybe add in, you have a few different doctors or nurse practitioners within your office that could be considered prescribers. It's basically just going to allow you to kind of pre-populate some of those fields within the form, make it a little bit easier and faster, especially for forms that involve progesterone. But again, that part isn't required. So we'll jump back to this practice field here. So this is just a search box. We try to have as many of the practices in there as possible. If you're new, there's a chance maybe that the first time you're using this form, your practice name isn't going to be in there. But let's say it is. You'll see here I can search up here and I pull up Erie County Community Health Center. So I select that. It's going to sort of show me all the relevant information. This information can't be modified at this point. If you see any issues, you see the note below. If there's any issues, maybe you want to make a correction, or somebody, maybe the contact email is wrong because that person has left the practice. Just send an email there and we'll get it quickly updated as soon as we can. Once you've selected that, you can advance to the next page here. But as I mentioned, maybe it isn't in there. So I'm going to type in Duet Health where I work here. You can see that obviously isn't one of the practices. And so it gives you an option here to create a new practice. From there, you can kind of quickly go through, enter in the information. At a minimum, we need these kind of top 5 fields here: the name, street, city, state, and zip. Again, those other pieces you can enter later in the form, or if you enter them here, then we'll have that information. That way, when we do go ahead and get your practice kind of saved in there, you'll have that. So if I hit save with this new practice, hit next, now you're in sort of the kind of heart of the form. Everything should be pretty kind of self-explanatory. Again, if you have any questions, reach out to the contact email. Once you're logged in, if you have any issues with the site, maybe you saved a form and you're not sure how to get started again with it, or any issues that you may run into, we do have this help tab at the top here. That's a little form. All you'll do is enter in your information there, whatever question or concern you may have, and that gets sent to my inbox here at Duet Health. So then I can reach back out to you and either let you know something has been taken care of, or sort of start that dialogue to figure out what your issue may be. So as I progress through the form here, you can see the different fields. We mentioned the save for later option. So at any point, you can hit save for later. It's going to quickly kind of highlight things as red, which is basically just showing you that those are the fields that are required. But then I'll take you back to this main page. I didn't enter in a patient name, so it just basically assigns that patient the new patient status right here. If I go to continue the form, and I'd say I keep progressing through here, and I get to a page and I can submit it here. So I say, no, this person was not a progesterone candidate. As soon as you hit submit, it's going to take you back to the first page, or that you're missing information. So perhaps you filled the whole form out and you just accidentally skipped one field. You'll be able to quickly find that field that's missing, get that populated, and then go back to be able to submit the form. Once you've submitted forms, those will show up in this patient submitted tab here. This would be a full list. So if you're not sure if somebody else in the office has already entered a form, that's a great place to go ahead and look. So that's you'll be able to view the form there, and any issues, we can go from there. Archive patients, that's just where your forms are going to go after a year. And then as Kathy quickly mentioned, you'll be able to sort of view data and analytics on your practice. So that's within the analytics section. I know we're running short on time. We want to make sure you guys have time for questions, and so we can cover some more of those analytics pieces on the next call. But I did want to call that out, that's where you'd find that. And so with that, I'll open it up to any questions that maybe even asked in the chat, or if anybody wants to ask them, we can, I'm happy to talk through anything here.
Sean, can you show where they can access the resource, where they can access the Medicaid assistance?
I'm not sure what you mean.
I'm sorry. So when they have a patient who has a need, and they want to identify that for Medicaid, could you show them that area?
Yep, absolutely. So there's this page on the form. After you enter all the patient demographics, this is the page. So basically, it has a check or a little drop-down box at the top, lets you say whether you'd like any assistance from any of those organizations that are mentioned, and notify them of these things. You can feel free to enter this information either way. If there's anything you want to share here, but if you hit yes, then it's going to make some of these fields required. So then it's going to ask you to kind of fill out some of these things. You can select any and all resources that you feel the patient would benefit from, and even have a sort of open text field to hit other needs. So if there's something that's kind of specific to this patient that's above and beyond what's available in that drop down, you can use that additional area to type that in.
Thank you. Thank you very much. Any questions for Sean? Thank you very much, Sean. We can go on to the next screen then, or go back to, there we go. I think we'll be starting at slide 36. I thought you might be interested to see so right now how many PRAF 2.0s are getting submitted to Medicaid. So this is a map that just shows you on the left-hand side, it shows you in the last 12 months how many PRAF forms have been submitted, and then in the last 30 days on the right-hand side. Next. The Moms Plus project has given us an example of a flow map that they feel that they can use for utilizing the PRAF 2.0. And basically it starts out where you're seeing your patient and identifying their needs, and then you're submitting the PRAF form and getting reimbursed for it. Then the process goes on, you get reimbursed, the managed care plan gets notified, you notify them of the patient's needs, and in the end, the patient has positive outcomes and you have a healthy, thriving baby. ODM is really encouraging you to fill out the PRAF 2.0. It's the preferred method. It's for all Medicaid pregnant women. Next screen. On this screen, this shows you what kind of resources are available through the PRAF 2.0. And it just talks about how Medicaid and the managed care plans can help moms with any type of need, if they need housing, if they need employment, if they need to have referrals to different services, any smoking or transportation, if they need cell phones or diapers or etc. There's many different links. Now, for patients with substance abuse, there is an added consent form needed just for the patient's privacy for such a delicate situation. Next screen. And so what we'd like to ask from you now is, how can we get started and how can we help you get started? Can we get you to agree to try this with one patient, or to to evaluate it? You tried it with one patient, this is what happened, you look at it and you try it again after you've evaluated it. And can we help you with that? We can have personal calls or whatever you need to help you get started. And the next screen, we have a polling question asking you just what you think you're willing to do in the next 2 weeks. Do you think you can get one person from the office to get access to the MITS and Nurture Ohio system? Or could you identify the person who you want to be responsible to complete the PRAF 2.0? Would you be willing to go as far as to say that you'll submit a PRAF 2.0 for one patient? Or do you want to go as far as saying, I'll do it for all of our patients? or you're not really sure, you think you need more information. I'll let the polling question go up now. And Brianna, are you able to do that?
We are, and it looks like we do have some people answering, so we'll leave it live for a few more seconds to let everyone participate that wants to participate.
Thank you. And again, if you're having any trouble with that, go ahead and put it into your into the chat box.
All right, we just ended the poll, Kathy.
Okay, thank you. Can you show the or read off the results? I can't see them.
Yep, I sure can. So it looks like for the first option, have one person from my office get access to the MIT and Nurture Ohio State. We have about 21% of people interested in doing that. To identify a person at my office who will be responsible to complete the PRAF 2.0, we have about 7% of our listeners who want to do that. We have the submit a PRAF 2.0 form on one of our patients. Again, 7% are interested in doing that. And submit a PRAF 2.0 form on all of our patients. We have 29% of people interested in doing that. Lastly, we have about 36% people who are uncertain and are interested in more information.
Thank you, Brianna. I'm really excited to hear how willing you are to get started on those things. And for those of you who did put in uncertain, we'll be reaching out to you, or feel free to reach out to us first if you don't hear from me or Mary or Andrea soon. Next, the rest of the slides will show you some resources that are available. Next, we are going to have another meeting on December 4th to follow this meeting up, where we're only inviting this group of people who were on today's call to attend the call on December 4th. And we want to hear about how you did. Were you able to start using the PRAF 2.0? What kind of problems did you have with that? And we also are going to go through a little bit in more detail about how you can see your data. Now, feel free to contact me at my email. And again, we'll be sending these slides out. And just to let you know, we will be offering this same kind of two-call webinar series again in 2019. So share that with your peers. Next. This is similar to what Alicia said earlier with what kind of questions to ask if you have MITS login questions. And then below is the email for progesterone PIP at medicaidohio.gov. This is direct link to the Medicaid and to any problems that you're having with the PRAF 2.0. Next. This very top link is the Medicaid Ohio website, and this has everything about the PRAF in it. The PRAF instruction sheet, the 10207I, actually has that billing information that was asked about earlier in the call, and it is located on the Medicaid webpage, as well as when we send the slides out tomorrow, we'll send a direct link so that you can get to it directly and find it. It's on the third page at the very bottom, and it spells out how to bill each managed care plan for submitting the PRAF. The Nurture Interface User Manual that I have listed here is also on the Medicaid webpage, but I pulled it out here for your convenience. That will walk through everything that Alicia and Sean went through today for you so that you can get your access. And then if you need any resources on progesterone and patient educational materials, our OPQC website is available for that. Next. I know that we're running pretty short on time. Is there any questions that weren't able to be asked? If you do have questions, I'll stay on the call for after this. Or please, if you don't have time to stay on to ask the question, please make sure to take my email and send me any questions. Next screen. I do want to make sure to thank all of our funders for assisting us with being able to do all this work to reach the goal of improving infant mortality in Ohio. Again, I will stay on the call for another few minutes if anyone wants to stay on to ask questions. If not, feel free to go on to continue on with your day. Thank you very much for being on the call today.
Thank you, Kathy. Bye-bye.
Bye-bye. Thank you, Susan. And again, I am still on the call. If you have any questions, feel free to reach out. Thank you all for attending.